Assalamu alaikum and welcome to the 9th online workshop for community companions. I'm your host, Zevanissa Rao, and I'm pleased to meet you all here today. Community Companions is a project of Hounslow Muslim Centre designed to support the elderly and vulnerable. Today is the 9th workshop in a series to help engage and empower the elders in our community in matters related to medicine, mental health, legal matters, hobbies, and social activities. Our guest today is Nihad Rashid. Sister Nihad has a degree in early years care and has previously worked as part of a care agency for 3 years. She describes realizing that many of the elderly under her care, although with grown bodies, but due to conditions like dementia, possessed the mind of a child and were helpless to whatever treatment they received. She felt a need to develop care that was focused and dedicated to not just the physical, but also the emotional needs of the client. And so she opened her own care agency, Concord Care, the details of which I put into the chat room. I have asked Sister Nihad to share her knowledge of this field devoted to the condition that is dementia and how to live well while suffering from it, either as a patient or even as a carer. Sister Nihad, over to you.
Thank you, Sister. I'm going to start my presentation. My name is Nihad Rashid. I'm a registered care manager at Concord Care Services. We look after the elderly and people with dementia in particular, with any disabilities, and all sorts of illnesses. But today we're going to speak about dementia because a lot of people in the community are suffering in silence. They don't understand that there's help out there. And it's just nice to know that there's help out there. There are people in the community you could speak to, where to find this help, and all sort of, advices. So I'm going to do a presentation on this, just a little bit about it, and the people who are caring for their elderly or spouses, family, friends with dementia, and really how to go about it. The main important issue is just to know where to find help, either in care or the organizations are out there, especially the Alzheimer's organization in the UK. So I'll start with this, and then maybe we can talk a little bit about where to find this help. So I'll pull out my presentation and start sharing. I hope everybody can see my slides. Yeah, okay.
Yeah, we can see them. Yeah,
so what is dementia really? We just want to describe what is it, it's an illness of the brain. It describes the symptoms of memory loss, difficulty with thinking, problem solving, or just behavior, because you tend to feel like, why am I losing my mind all of a sudden? I know this. Why am I now, thinking twice, or like having this memory loss? So dementia is not a disease in itself. It's a collection of symptoms, so these symptoms that result from damage from the brain caused by different diseases such as Alzheimer's, and there are many others. There's vascular dementia, whereby somebody maybe has suffered from stroke and then it has injured any, nerve in the brain, and then causes a bit of memory loss. So all this, so you have to understand, it's not only Alzheimer's. Alzheimer's is one of the symptoms, but there are many more to do with dementia. These symptoms vary accordingly to part of the brain that is damaged. So it could be very small or very huge damage, and the progress So once somebody starts losing their memory, it progresses and advances very quickly. Like you have to understand that it starts slowly, but definitely is going to progress to a major, memory loss, whereby you really need to know that it's going to be a progression. I would just like to share a video just to see those who are living with dementia, just for your, so I'll play this, if I'm able to, maybe just play it for you. Can everybody see the video?
No, the video is not showing. It's still the dementia slide showing at the moment.
Let me share this again.
According to the Alzheimer's Society.
Can you see it or not yet?
No, just
Okay,
the slide.
let me try something else. Stop sharing. Share it again. Yeah.
Okay.
I hope everybody is able to see this now.
Yes, we can see the screen now.
In 2015, 850,000 people in the UK will have some form of dementia, with the figure predicted to rise to 1 million by 2025. It's an often undiagnosed disease, which is most common in older people, but it can occur as early onset in middle age. For people with learning disabilities, the condition can occur even earlier.
Dementia appears to be more frequent now partly because we're much better at looking after old people. People don't die young so often now. If you to 40, 200 years ago, you were an old person. If you live to 75 or 80 now, this is the normal life expectancy.
Alzheimer's disease, which is the commonest cause of dementia, doubles in prevalence with every 5 years we live over the age of 60. So that people in their 80s and above, 1 in 5 have dementia. Essentially, it means that the things that make us higher thinking beings, our memory, our way of calculating or planning, language, they are degenerating.
Dementia is anything which is affecting the brain and the loss of function of the brain in such a way that the things that we normally take for granted, for example, our ability to remember things, times, dates, events, to place ourselves in a location, to use words, to use language, all of these things begin to disappear.
The most common early signs of dementia include memory problems, declining communication skills, recognition and coordination difficulties, disorientation, as well as changes in behaviour, judgment and mood, and loss of daily life skills. Dementia results from a loss of brain function. As we get older, in a normal brain, there's very little change with age.
What we see is if we take somebody who's got normal aging, this is their first scan, and we take a second scan a year later, there's very little change. It's quite different in Alzheimer's disease.
Brains of people with Alzheimer's, the most common form of dementia, shrink dramatically.
There's devastation going on. Alzheimer's disease is destroying the brain cells, and the brain is shrinking.
Depending on where those changes are, for example, if they're in an area which is important for memory, then memory will be disturbed. If they're in an area that's important for language, then you will lose ability to understand words or to be able to use language in the way that you perhaps might have done.
These are the observable changes, but what's happening within the brain to cause them? Brain cells called neurons communicate with each other via electrical impulses, which trigger the release of chemicals called neurotransmitters. These pass between the cells. Neurotransmitters pass between gaps in the neurons called synapses. In Alzheimer's, abnormal protein deposits inhibit the neurotransmitter signals. It's common to see these protein deposits in infected brains build up into plaques and tangles. Over time, the plaques and tangles destroy neurons' ability to communicate with each other. They die off, and functions like memory and thinking skills are affected.
That process of indigestible protein, lumps of stuff in between the cells, actually affects the brain function, affects the brain cells communicating with each other and this brain. So, for example, this area of the hippocampus, which is so related to memory, we see shrinking down, and at the same time, people complain of forgetfulness.
The hippocampus is the area of the brain most important for memory.
Now, this region here, called the hippocampus, has been long known to be important for storing and retrieving information. And we were thinking about neurons and synapses, and each of these regions is connected by a pathway, where there is a neuron at one end and a synapse at the other. And if we are storing information, pathways will be activated linking cortex to the hippocampus, and we will learn, for example, the name, somebody's name, or a place or a location. That information will be stored within the hippocampus. And when we remember something, pathways which bring it from this deep area out into the cortex, into the conscious brain, will allow us to remember something and understand the context in which we remembered it. Now, somebody with dementia, and in particular Alzheimer's disease, these pathways will be severely interrupted. And what's happening is where there will be a normal, healthy pathway to store or retrieve information, elements of this pathway are lost, and the cells are not working as well as they should. So therefore, when we try and store information, the ability to store it may be lost, and therefore when we come to retrieve that information, we may not be able to store it properly, or we just not maybe able to access that information.
Alzheimer's disease has a dramatic impact on memory. Modern imaging techniques have indicated ways to spot the disease in its very early stage.
We look at the scan, what we see here, this is somebody with mild cognitive impairment. The scan may not look that different to somebody with a normal aging. But if we look at the change here now, just over a year, I'll flip forwards and back between these two scans. That's the first scan, that's the second scan. Look at this increase, this black area, the ventricles, that space, fluid space within the brain, that's enlarging. Look at this, the space around the hippocampus here, that's our memory sphere. It's just shrinking down. If we look around the temporal lobes, the language, the frontal, the parietal lobe, thinking, calculation, study, they're all shrinking. If we take a series of scans of somebody in the very earliest stages of Alzheimer's disease, here's the brain scan at the beginning, here's another brain scan of the same person 18 months later, and then a further 18 months. So there's 36 months across it. That's for 3 years. That 3 years is often an insidious period of change when, remarkably, people may have some mild symptoms and they may even get a diagnosis. Look at this blown up, magnified section here, what's happened to the hippocampus. Devastating destruction. Dementia just reflects what's happened to the person, the brain, that syndrome of cognitive decline. Alzheimer's disease is a pathological definition.
The second most common cause of dementia is vascular dementia, a condition linked to the blood vessels in the brain rather than the brain cells themselves.
This is caused either by lots of strokes within the brain, sometimes quite small ones, or a cutting off of the blood supply to the brain in general. And this will cause various regions of the brain to die and become dysfunctional. vascular dementia is quite commonly occurs at the same time as Alzheimer's disease. So it can be difficult to say whether somebody has purely Alzheimer's disease or purely vascular dementia, but they can have sometimes a balance between the two. These white blobs that you see here, that's destruction. That will be a vessel having been blocked or having less blood supply to that part of the brain. And little tiny patches get eaten out, but as we progress, as the burden of this vascular damage gathers, then you start the thought process is slow down, the connections get more difficult, the loss of memory, the loss of planning, the speech, the gait problems, the emotional ability that you get more frustrated, the rapidly changing mood. They're all part of that.
The diagnosis of dementia is not straightforward. There are no direct diagnostic tests, and dementia affects individuals in a range of ways. A GP should be consulted in the first instance in order to assess a person and to provide help with a diagnosis. The GP is the usual person to make a referral to a specialist.
During life, Alzheimer's disease in particular is a diagnosis of exclusion. You rule out everything else, and what you have left is likely to be Alzheimer's disease. We importantly need to exclude depression. We then will go on and we'll do imaging to exclude a rare case of a brain tumor, try and quantify how much vascular damage. Is this really vascular dementia or is it Alzheimer's disease? In some situations, we will do measures of brain activity. Could seizures be mimicking Alzheimer's disease or something like that?
Early diagnosis and research are being helped by MRI or magnetic resonance imaging, which gives a very detailed view of the brain.
Scanning, MRI scans in particular, are starting to give people a little bit better certainty on the diagnosis. The real test for Alzheimer's disease is still very, very clinical. So it is actually asking somebody, taking a good history, examining them, and the imaging is just helping us to be able to make diagnosis slightly earlier. There are novel techniques that are still in the really at the research stage where we can actually do scans that look for the specific protein. That's called amyloid imaging. To be able to see in life what's going on in the brain, not just in terms of the structural degeneration, but also the proteins that may be driving that destructive process.
Apart from the care that everyone living with dementia will need, drugs used in the treatment of Alzheimer's disease can temporarily improve symptoms and slow down the progression for some people. They cannot, however, provide a cure.
The real research drive is not just to try and make the brain work a bit harder or a bit better, which is what these subjects do, but more to try and comprehensively halt this dreadful destructive process. And we do know that all the pathological hallmarks, amyloid plaques, neuronal destruction, are occurring many years before anybody is ever diagnosed. So there is a window where theoretically we could intervene to preserve brain tissue and brain function at the stage when I think all of us would like it preserved.
So I'll stop sharing that and then come back to the, I hope that has at least given us yeah. Okay, so at least that has explained so much about dementia from the doctor's point of view, medically, what can be done, what cannot be done, you know, the types of dementia. Alzheimer's is the most common one, as he said. So yeah. Now, going back to the symptoms, I think he's explained more: memory loss, asking questions repetitively, increasing difficulties, increasingly having difficulties with any tasks, activities, you know, with the planning, becoming confused, unfamiliar. Some people suffer even like the parents don't know them again. and it becomes very, very stressful. So these are all the signs of Alzheimer's, or maybe they could have had a stroke, so it had and has affected any you know vein in the brain. So yeah, a little bit about the types. So yeah, this is the most common one I've explained is the Alzheimer's. So there's vascular, and then there's dementia with Lewy bodies, and then the frontal temporal dementia. So these are the four types under the umbrella of dementia. But the most common one that everybody, a lot of people are suffering from is the Alzheimer's. Now let's go on taking the role of the care of the care. As much as you don't want to be called a carer, because this person is a member of your family, or is your spouse or your friend, but if you're the one looking after them, definitely you fall under the carer. Taking this role, supporting this person with dementia, can have a lot of impact in your life. As some are positive, some could be negative, but as it progresses, again, it takes a toll on the carer, because you're left to think about it. Some people are guilty, they not knowing how to support the person. They're worried with grief. What has happened to my mother or my spouse? Why are they acting like this? Some are angry that why do I have to keep repeating myself? Why do I have to, have all this patience? Why don't you understand? But it's a process they're going through. They're losing their memory slowly, and it's not their fault. Some in the community are very embarrassed even to just face people and say my family member or my spouse is has dementia. It's almost like a taboo, or you don't want to mention any, is it a disease, or and it's very common with a lot of communities. And so yeah, I think it's worth mentioning there are a number of things to think about, in the early stages, before it progresses, that a lot of things are going to change, and the sooner you understand that this person is going to be progressing in their memory loss, for you to seek help out there. What are you going to change? What changes do you have to do in your daily lives? What kind of support do you need in place to just be able to support this person, to be able just to ease off a lot of things also on yourself? It's very important, and everybody needs to understand that there's a lot of help out there, from the Alzheimer's organization, starting from your GP. One thing I want to mention: once you realize that maybe the person you're living with is starting to forget things, these are the early signs. Maybe you need to speak to your GP to just have that assessment, so that the sooner you catch it, the better, to be able to plan things and get that support in place. Once your family has been diagnosed with dementia, the next thing to do after the GP has already diagnosed, you have to know that the social services is the next thing. You have to go to the social services, give them a call and arrange, if you need carers to just help out if you're working or you just need that helping hand for them to be coming in and just, for a few hours to take care of your loved ones, just to ease off a lot of pressure on yourself. Um, because you have to understand that as it progresses, it becomes very difficult. So you don't want to strain yourself to be able to reach a point where it's a breaking point. Before that, you need to understand there's a lot of things you need to plan ahead. From your GP to the network support to your local authority, the social services. And also, you have to understand there's also an organization for this, the Alzheimer's, and I'm going to put the link and their telephone number just in the last slide for everybody to just get that. You can give them a call and just see which way to get help. So the next slide is just really for just a little advice for the people who are caring for their family or their spouses or their friend. You need to be very understanding with the person with dementia. They're going through a phase. It's going to progress. This is and it's something as you had from the medical practitioners that it progresses. There's no cure to it. So as it progresses, it becomes worse. So the better understanding of the disease of the dementia itself, just understanding it. What is it? How do I start dealing with this? Because that's the first step, and then communicating with the person, and letting them know that they're suffering from this, or in the early stages, and you have to understand when it's already progressed too late. They won't be able even to understand that they're dealing with memory loss. They won't even understand that. So maybe in the early stages, just to communicate with them and making them understand when they ask, why am I forgetting things? But and they become sad about it. Maybe you just need to mention that you've got dementia and it's in the early stages. You have to understand that they will have a lot of language problems. Sometimes they would, speak, maybe hallucinate. And this is also, again, in the later stages. You have to know that you have to manage the symptoms. And again, if you feel that it's becoming worse, maybe speak to your GP and see what ways you can get help from them. And again, another thing is also supporting the person to stay healthy and active. It's very important. Again, that also slows it down, their healthy eating. When they exercise. And I think Dr. Wakil can also maybe elaborate more on that after. So maybe I could hand it over to Dr. Wakil, and you can give us one or two aspects on the healthy eating, or how to stay healthy.
Assalamu alaikum, Dr. Wakil. Welcome.
Wa alaikum salam wa rahmatullahi wa barakatuh. Can you sisters hear me?
We can hear you. Yes.
Alhamdulillah. The video that Sister Nihad shared kind of explained most of the things about dementia. But what I would like to start from is, like, as Muslims, we believe that everything has been decreed by Allah. So we always look at everything through the prism of Islam first. So, it's good to get informed, get the information, the correct information, of course, And after knowing that, the number one thing we do is make a lot of dua for Allah to protect us from this. And just like everything else, after making this dua, after number one, getting the correct information. Number two, making a lot of dua. Number three, now we need to know what can we do. Meaning this is following these information, following our dua with the proper action. What can we do to slow this disease down, and what can we do to prevent it if that's possible? But so there's so many dimensions to it basically. So how I would like to go over this is I would like to explain some of the myth that is surrounding dementia as a disease, and also give us some information on what we can do to prevent it if that's okay. So basically, we know dementia as is just a symptom of a larger disease. So this is why you see he said like in the video that this it's a diagnosis of exclusion. So you try to exclude everything else. It's like someone being tired, you know, consider like tiredness. So let's say dementia is like tiredness, but there's so many things that can make you tired. You can be tired if you have malaria. You can be tired if you have um, anemia. You can be tired if you overwork yourself. If you be tired if you're hypoglycemic, meaning you're not eating enough. So there's so many things that can make you tired. So that dementia is a symptom of a larger disease. This is why you see they explained in the video. There's so many different types of dementia. You know, we have about like, as of the last count, we have almost like 10 types. But out of those 10 types, there's about 3 or 4 of them that are very, very, it's worse than the rest of them. So the number one is Alzheimer's. This is the general one that most people know. And one of the myth is people compare or they confuse Alzheimer's with dementia. But dementia is just one aspect of Alzheimer's. You know, the umbrella, the sister shared a slide that was a really good slide, the one that has the, I think it's slide number 3. You see this umbrella of dementia and all of these things that are under it. Even though it's only 4 that is specifically stated here, there's more than 10 types. You know, you have this Alzheimer's, the vascular dementia, frontotemporal dementia, Lewy body dementia. There's Wernicke-Korsakoff dementia. This usually happens with people that they drank so much alcohol that now they're deficient in the vitamin called thiamine, and that affects a part of their brain, and it completely changes their personality. Frontotemporal dementia because the human being's personality resides in your temporal lobe. This is the frontal right part of your head. So, you know, anything that affects that area is going to affect how you act. So maybe the person is usually calm and gentle, now they're overly aggressive. Or maybe the person is usually talkative, now they're more calm. Or maybe the person is calm, now they're hyper. So these are the things that we need to, you know, inform ourselves of. There's Creutzfeldt-Jakob disease. This came through the time when the Germany was, you know, persecuting the Jews. So the person that found it out, they named it after that. And there's mixed dementia. There's Huntington's disease. You know, so all of these things you can have dementia then. So we should look at it like that. That's number one. Number
Could I,
two, yes,
sorry, could I just quickly ask that of all of the causes of dementia,
yes.
be they illnesses or even injury or alcohol consumption,
Yes.
are there any that can be reversed even to a slight degree?
Yes, the answer is a two-way answer, yes and no. Meaning, when we speak about reversal, there is delirium, the delirium aspect of dementia that could be reversed, where people feel like they're losing their mind. It's not just about memory loss. So that part can be reversed. But dementia itself, it could only be slowed down once it starts. And also speaking about the types, if you have the one of the 4 or 5 types that are very aggressive or rapidly progressing, there are things that you can do and not do to slow that down. This is what we can do. Also, one of the myths to kind of follow up with that question, one of the myths of dementia is that people think it comes with age. Like, if you grow old, automatically, like everyone is going to get dementia, which is not completely true. Like, if we look at like the recent data on dementia, says, 17% of people between, okay, let's start from 65. 3% of the whole world will have dementia before 65, between the age of 65 and 74. So this decade between 65 and 74, it's considered based on current data that we have that 3% of the population will have dementia. Now, from 75 all the way to 84, it is reported that 17% of the world will have dementia. Now, notice I'm saying dementia, it means the all the umbrella disease of all of that. So, for instance, someone has Alzheimer's, dementia is included in that. So you might have dementia. Another person has is a drug, so he has this Wernicke-Korsakoff one, he might have dementia. This person has a genetic thing called Huntington. So this one, that person is also going to have dementia. So it's not just one thing. So this is why it gets confusing when people speak about this. But the highest percentage is 32%, which is people that are over 85 years old. So basically, if you look at now, you have 100 people that are over 85. So 32 of them is going to have dementia. This still leaves 68% that is not going to suffer from dementia. So if you look at it like that, it's still good news. It's not a death sentence. Another myth is the fact that, because let's say my father had dementia or my grandfather had dementia, now I should be scared that I'm going to have it too. So that depends on the type of disease that caused their dementia. So out of the four types that we spoke about now, uh, a lot of them are not genetic. For instance, vascular dementia is not genetic, Lewy body dementia is not genetic. An aspect of Parkinson's might be, Wernicke-Korsakoff is not, Huntington is. So this is why we have all of this confusion around dementia. But the good news is, until you specifically identify the type of disease that, neurodegenerative disease that caused that dementia, you can't say automatically you're going to have this. So this is it. There's another myth where people think, young kids cannot have dementia. It's very possible for a teenager to have dementia if he has got Huntington's disease. The genetic defect that causes that is one that we call autosomal dominant. Autosomal dominant just means this thing. If you have one pair of this gene, automatically you're going to have the disease. So if my grandfather has this disease at 65, for instance, because it's autosomal dominant, I might have it. He's going to pass it down to me. I might have it while I'm 55. And because it's autosomal dominant, if I have it at 55, it's very possible that my kid might have it at 45, or his kid might have it at 35, like that. So it's not automatic that everybody's going to have dementia, but a type of it is very possible that, young kids can also have it. So after discussing all of this and the myth and all of these other things that are connected to it, the most important thing that affects us is, what can we do? Is there anything we can do to either prevent this or reduce it, or kind of fortify ourselves to reduce the probability of getting this dementia? Now, another thing, just before I move on, is sometimes when older folks, they forget something, so now automatically they think it's dementia. No, it's not. Even if you live in a very stressful environment, it's very likely that you might forget things sometimes. So there's so many, like, for instance, in the United States, I'm originally from New York, for instance. For instance, in the States, there is about 5 or 7 criteria that you have to consider. So it's not just that they're forgetting things. but this forgetfulness is affecting their quality of life. Not only that, they're becoming agitated, they're becoming confused very easily. So there's so many things to consider to diagnose dementia as a disease. So what are the things that we can do? The number one thing that we can do, and neurologists will tell you this, is to be active. This activity comes in different forms. It's not just about exercising. Our brain are like a muscle. The more you work it out, the stronger it gets. Now, the older we learn, and this is also we can bring it back in time back to Islam. It's normal. Aging is part of the natural order of life. But Allah subhanahu wa ta'ala in his mercies has already inculcated in us or exposed to us or shown us things that we need to do, which is seeking knowledge in any way, in whatever shape or form that might be. And whether it's Arabic, whether it's a new language, whether it's how to learn how to do crochets, how to sew, something new. Because when you learn something new or when you're engaged in something new, your brain are able to grow new neurons. So you have new neuronal pathways, which is you can consider it like strengthening your muscle. So the stronger your muscles are, the more muscular you are, the more powerful you are, the stronger you are as a person. It's the same thing with the brain. So whether it's even just playing Sudoku or anything that stimulates your brain, that activates your brain, that tasks the brain is a good exercise for you. And of course, anyone that's over 40, 50, you should have a brisk walk of minimum 30 minutes a day, not just be dormant and slow and things like that. So the number one thing we can do is to make sure we activate our brain, we exercise our brain. And how can we do that? Read books, read novels, memorize something, learn a new language, learn a new trick, pick up a new habit, pick up a new sport, something new. This is the number one thing we can do. The number two thing we can do, the second thing is about eating healthy. So most of these things that they no brainer. These are things that we already know. You know, it's just that some of it are very specific when it comes to dementia. Eating healthy is a cliche word. Certain things. For instance, you're supposed to eat a whole lot of fruits and vegetables. This is where it's very specific. The vegetables, yes, you're supposed to eat a whole lot of leafy vegetables. But as for the fruits, not all of them passes. The specific fruits that aid you and help you against dementia are berries, whether it's blueberries, raspberries, whatever berries. All of the berries, the berry species, we should definitely pick that up. Number three is not to smoke. And if you look at it, you can understand one of the hukum behind some of the ulama saying that smoking is haram. Of course, some people you might come and bring, the lead to say, oh yeah, there's some people said it's makruh, others no, 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 no. You know, at the bottom of it, most majority of the opinion, smoking is haram for Muslim, whether you're a man or a woman. Same thing with drinking. Why? Because this thing have more negative effect on you in the long run. So it's almost as if you're killing yourself slowly. And medically, there's so many things that smoking does. Whether it's, it gives you thrombophlebitis where your veins are inflamed, whether it gives you lung cancer, skin diseases, neurodegenerative disease, just like this one. So many things where smoking is a risk factor for. So as Muslim, this is part of our deen already. So you're not supposed to smoke. The number four is alcohol. As Muslim, we shouldn't drink alcohol, but if I'm speaking to patients that are non-Muslim, I'll tell them drink less alcohol. So be physically active, not just about physical activity, but physical brain activity. Eat healthy, do not smoke, drink less alcohol, do not drink alcohol because we're Muslims, and basically just taking charge of our health in general. Now, these are things that we can do to increase, our fortification or our defense against Alzheimer's. One crucial point is social contact. Recently, there was I think it was the longest study conducted so far about, it's been going on for over 60 or 70 years. I think it was something connected done in Italy. And this physical contact, this social contact was one of the reasons that keep people happy. It boosts your mood, reduces stress. So anything that's going to reduce stress is going to reduce your probability of getting Alzheimer's. Okay. So these are the main things that we really need to watch. And there's a lot of information out there. We need to be very careful that we get in the proper information. So there are times people will tell you, oh, take this vitamin or take that. Yes, the vitamin can help you to live an optimal or healthy lifestyle, but to have a direct effect on Alzheimer's, the studies are still not very conclusive. There is the alternative medicine where people say, okay, use coconut oil to cook. Yes, there's some studies to that about, I think there's about 7 or 8%, you know, where the way it prevents you from getting this. But the bottom line is to live as healthy a lifestyle as possible. And red meat was supposed to cut it down, you know. So these are just the general overall things to discuss about Alzheimer's. If there are any specific questions, please you can go ahead and ask.
Jazakallah khair, both of you have just given amazing and informative presentation on the topic. And we can see how well versed you both are and the genuine concern you have for people in this condition.
Yes. Just so I think the sister is sharing the last slide. These are places where you can get help. You know, there's the Alzheimer's Society, and there's also a dedicated dementia helpline. You know, there's a plethora of resources and support for people to have that have this, or people to know more about this in the UK. And also, as Muslims, we should not forget we're Muslims. So before we do anything in life, the number one thing we go back, we have that tawakkul. You know, we go back to the Rabb, the one that created us, that knows us better, that knows what He's testing us with. So that dua is number one before anything else. May Allah protect us and our families from this disease and all of the disease that is ravaging the society, and increase us all in all that is good. I mean.
Ameen, Ameen, Summa Ameen. I have a question that perhaps you could help with, Dr. Wakil, that apart from treatment with drugs for dementia, so there are other methods. You've obviously described taking a hobby, engaging your brain. There also encouragement for someone who's suffering with this, to perhaps go back into memories and discuss childhood, their life story. Life story work in which the person is encouraged to share their life experiences and memories. And reminiscence work is good for mood, well-being, and mental abilities. So I was just wondering that, what do the doctors advise if a patient remembers things incorrectly or believes that they're in a time period that has passed? And so often they confuse family members for other, you find situations where a husband could be calling their carer a mother, because perhaps of the feeling of protection that they're having from them, but obviously they're not their mother. So should they be corrected, and if so, to what degree?
Yes. So now this goes by. This has to be personalized. It goes on a case by case basis. You know, if the patient is the type that will not be aggressive, or if he's not going to lead it to more depression, so they should be corrected. You should not pretend to be their mother. You know, but it depends on the patient. So there is no one size fits all when it comes to this. And speaking about the childhood and try to remember things from the past, yes, this is the way to strengthen some of the memory path, some of the neuronal pathways in the brain. This is a good idea. And there's so many things that they advise to do. They keep journals, they make video diaries and things like that. And this is what also, as a Muslim, you know, There's a hadith that one of the Sahaba said, the Prophet ﷺ said, a Muslim shouldn't go to bed without having his will. There was, I'm not sure if I'm correct on that. I think it's by maybe a day or a week or something like that. I may have to check that. But there's something specific about that, meaning that Muslims were supposed to be prepared for everything. So these are things we should be discussing with our family and discussing with our friends and our trusted circles. In case this happens to me, this is what I want, this is what I want, this is what I want. So the idea in managing Alzheimer's patients is to continue to remind them of who they are. So, but that reminder is very, you have to strike a balance because you don't want to get them upset all the time. So, there, I remember there was a patient they brought in one time. He had a note, what is it, an iPad, and there's iPad, the screensaver on the iPad has his name and says, you are this, you are so, you are so years old, your wife is this, your kids are this, you have this, and you have this. So this is the first thing he reads every morning. So even though he might forget by tomorrow, but he reads it or he knows this is what's going on. So there's so many different ways for this. And now since, with technology, there are so many different ways to deal with these things, meaning like, people make video calls, they record, make video diaries, they call every morning. The most important thing is that routine. So once, even if you do forget something, you can still strengthen to gain some of those memories back, or limit how much you lose it. Because it's because the brain cells are dying, they're getting tired. This is why. So like I said, depending on the type of disease that caused the dementia, it can be managed and modulated really well.
Jazakallah, that's such an amazing advice and examples of what anyone can do to help at home with the video diaries and the iPad reminders. That's very good advice.
The other thing I wanted him to also Dr. Kil to touch on. Sometimes when it's progressed and reached a stage where they've forgotten everything. At that point, wouldn't it be useless for you to really go back and stress that this is this and this is that, because it also frustrates the carer. So the best thing to manage that when they're in that comfort and maybe thinking about, and maybe they're in their 40s, those that's the time he's in. I think maybe you could touch on that just to say, is it better to just, to cheer his mood, just to go along with that and make him happy, just to try and remember all those good memories and, what can you add on that?
Yeah, absolutely. You're right. This is why I said it's on a case by case basis. Don't forget, dementia doesn't just happen in one day, and it's not gonna happen within a week. Like you start losing your memory today and becomes worse. There's about 7 to 9 stages. From slight, moderate, severe, and all of that. And another myth about this is that it's not fatal. It can be fatal. It can be really, really bad and really progress really rapidly. But even in that, it still takes months to get to the hospital from the initial onset. Yes. Uh, it's, for instance, you have a psychotic patient come to the hospital and he says, yes, I'm the chief of this hospital. I'm doing this, I'm doing that. You don't go and debunk what they're saying right off the bat. No, you don't do that. You agree. You say, well, yes, you are okay. Just come in order to gain compliance. And after you gain compliance and it's been sedated and they woke up back again and that they're receptive to what you say, now you can now start explaining the condition. Yes, if it's deteriorated to the last part where the aggression has caused in, the depression has set in, and all of this apathy and lethargy is already set in, then it's of no use in trying to bring them back into all of that. You just work with what you have, and meaning preserving their dignity, making sure the mood is the mood is up, being healthy, being outside. This is it. You want also the foundation of this is to help the patient to live their best quality life they can live. And that, what it means for me is different from what it means for you or any other patient. So there's no one size fits all. You have to go based on that patient-centered care. So depending on the level that they are on, you can just let them enjoy that, you know, the story they build up in their head that makes them happy. So you don't have to always correct them. And by the way, these are not, this is not the carer's job or the nurse's job. These are special department that deals with this, and even the carers that are sent into the homes of dementia patients, you always, train them. You don't just say, for instance, call care now when they send out the carers to patient that has dementia. In the initial assessment, you know the type of carer you're sending them. So the person is already experienced in this aspect of life, so they can deal with this patient better. Otherwise, it's just a recipe for disaster if one just treat everyone the same. We can't do that. So that's it.
So that's good. The care agency does an assessment and they give you the advice of how to care and what to do. So
Yes,
that's
yes,
yeah.
absolutely.
Um, thank you for the answer, both of you. I mean, that's a very good point that it depends on the stage as well. Anyone here has any questions, then please do, you're welcome to open the video and speak. Otherwise, put the question in the chat room and I can read it out. Or if anyone has any experiences that they wish to share. Until we do have, I have another question that, is there help that could be provided at home for carers who are working or physically unable to support the sufferer on their own in situations where, say, the sufferer might leave the house without notifying anyone, or if they might be a danger to themselves or others without realizing it? So what kind of help is available in that situation?
Well, from my experience, when it advances to a stage where they become now harmful to themselves, then at that point, the local authority takes charge, and they're forced to put them in a care home. Before that, then what happens is they will be sending in carers just to help the main key carer, the family member who's really caring for their loved one, until it becomes a danger. If they become a danger to themselves, like in the middle of the night, they open the door and they think it's already in the morning, or I'm dressed up, or I'm heading to work, and it's in the middle of the night. So now they do take charge. Unfortunately, they have to place them in a care home where it's secure, where they, unless you can prove that you're able to facilitate a place that is very secure for them. Otherwise, they're forced to take charge and put them in a care home where they will be safe, and you will just have the visiting rights.
Yeah.
Yes, and for those, just to add to that, and for those that, their families sometimes they refuse, they don't want to send their parents or their elderly ones or to the care home, you have to prove that you're able to supply round the clock care for the person. If you're able to show that and prove that, yes, they might, so let them keep them at home. I've heard of cases where they have a sensor, like a band, where the person wears, so they're able to kind of follow wherever they go and things like that.
Yeah.
Are there carers that can stay 20, say in shifts, 12 hours, and in someone in the day, someone in the night? Is there a service available to such, to help in that way?
24 hours care is only given to the ones that are bedbound, or they have a severe disability and they're not able to really take on their daily activities. So they're forced to have that 24 hours care, but and they really don't have that family support. But once you have family support, maybe they would give you a few hours of the day, maybe at most three 3 hours of the day of care, and that can be for the 7 days. But unfortunately, if you do have a family or yeah, and another thing I want to mention also with the family that are really taking care of their loved ones who've got dementia or they're or they have a disability or any other kind of illness that has taken a toll on them, they can speak to the local authority. The social services can organize a respite for them, whereby they're given they're taken in for like maybe 2 weeks, and it's like a timeout for you just to be able to just do things on your own, things that you were not able to do because you were taking care of your loved one, 24 hours. So you didn't get time to do anything. So it's really taken a toll on you. It's now becoming depressing. It's really affecting your health. So you can get respite, and they give you like a 2 week holiday, whereby they're taken in somewhere, and it's like a maybe care home somewhere. They do activities, and it's around clock care for you just to relax and take time out. So that's another thing people need to know, that there's help out there. The most important thing is to start with your GP. Once you've been diagnosed, then social services, they will bring in the carers, and then uh, from there on, the people who don't understand that they could get help, like the dentist coming in for the elderly, where they're suffering from now their tooth are falling out, or they're very weak, they can't eat anymore. So you start realizing they don't want to eat because maybe they're in pain, or you need to ask your GP to organize a dentist to come in and see your loved one, just to get that help. Maybe then nutritionist will also come in to just demonstrate and give the foods that needs to be given to them now. Maybe you start giving them mashed food, all that, and that kind of uh, you know things that are not really they're not able to chew. So things that are going to be easy for them to just eat. So yeah, I will emphasize that there's a lot of help out there, and some help, if you don't feel like you can get it through your care companies. We've called the social services to get them the OT to come in and maybe assess what kind of equipments they need to just move around the house, to make it easy for you, so that you don't carry them, you don't bend and hurt yourself. Yeah, and all those kind of things. So
It's kind of a risk assessment that they do.
yeah, they'll
Yes.
come in and just fit in on.
And lastly, one more point. And this is not just limited to dementia. Alhamdulillah, we live in a country where we have these services. With anything connected to our health, it's always better to request or to go or to do things, to do too much than to do too little. So with everything, it's always early detection. I don't care if it's breast cancer, it is Alzheimer's, hypertension, diabetes, anything that we're able to detect early, we're able to tackle it early. So the prognosis is always better. So, if you have an elderly and we think, they might be suffering from this, it doesn't hurt anything. Go to the GP, request the test and things like that. So we should live our lives like that, just like the Prophet ﷺ always encourage us to tie our camels before we make dua to Allah to protect it. So we don't leave our door open and say, yeah, I'm under Allah's protection, or because of that, jump in front of the train or anything like that. So, and I remember one of our professors in school used to say, if you can't find time to be healthy, you're going to find time to be sick. Because when you're sick, when you're down, you have no choice. So, early detection is crucial to all of these things. And it goes to anything that we might be suffering from. So it's always better to do too much than to do too little, at least in the beginning. And that goes to, we should make this like a mantra for us and our family members and our friends and everything. You feel something, you felt something is not right, always have to get a checkup done.
Absolutely, that's excellent advice, and I hope you carry this through in every department of life, as you say, even for cancer, and especially for this as well. Does anyone have any other questions to ask at the moment? Because we have actually run out of time. There is a comment by Maruf Adoye. He has said salam and thank you, Dr. Vakil, for dealing with this very important issue in the community. He says, I was late in joining. Can you share your presentation by email or WhatsApp? Jazakallah khair. I will send a link to Sister Nihad.
Great.
If I don't know if the brother is still here, I'll ask Brother Maruf if you could send your phone number to the number in the chat room or to the number that I've added on there, which I will repeat now. Then I can send the details to you too.
All right, shukran, jazakallah khairan. Thank you very much. I really have to run now.
Oh, Jazakallah khair so much for your time, Dr. Wakil.
All
It's been
right,
extremely helpful. May Allah reward you profusely. And, it's been amazing because you brought it back to Islam as well and to the reality of life and the afterlife. So, it's just been extremely valuable.
Jazakallah khair.
And to Sister Nihad as well. Do you have any final comments, Sister, to say?
Not really. I think we've said a lot. We've run out of time. I mean, we're here to help if you need any care. So any support, please let us know. And we're here to help. And there's a lot of help out there. You just need to know that there's a lot of help out there. Don't be quiet.
Yes, absolutely. And from Sister Nihad, I can just see that, how sincere she is and how much she cares about the work that she does. MashaAllah. I did put the details of her agency, Concord Care, and that again, I will post again into the WhatsApp group for anyone who needs to know. And you can reach out to help for help. And if you'd like to offer feedback for the session, please contact again through the WhatsApp group. And because we've run out of time, just thank you so much for attending, everybody. And I'm sure we've learned a lot from this session.
Thank you for having me. Thank you very much.
Okay, assalamu alaikum.
Wa rahmatullahi wa barakatuh.